Welcome, everybody, to the Better with Age podcast, episode number 3. Today, or this evening rather, I have the privilege to be able to talk with my friend Jenikka Tomashek. She's a doctor of nursing practice and a certified nurse practitioner. I've known her for a number of years. She's as good as they come. So I'm super excited to talk all things perimenopause this week. So number one, thanks for being here, Jenikka. I know it is a busy house for you right now.
Yeah, it's always a pleasure, Galen. Thank you so much for having me.
Yeah, I'm excited. So tell everybody a little bit about yourself and maybe your journey to where you are now.
Yeah, so I'm a nurse practitioner. I've been practicing for 14 years. And my journey has kind of wiggled all over the place. I started emergency medicine, went to um, internal medicine after about 5 years, where I currently practice, but I also now work in integrative medicine as well. I've been doing two different roles for the last 5 years, and I absolutely love that. Having two different approaches to medicine is really interesting, and it helps both of my practices just to be a better clinician. So, um, and through that journey, I found women's health and
Mm-hmm.
perimenopause, and I stuck to it. And yeah, that's where my focus is right now.
That's awesome. Tell us a little bit about your private practice that you have, and maybe more pointedly, just why this is such a passionate area of practice for you.
Yeah, great question. Like most people who get passionate about a topic in medicine, it is stemmed from a story from myself. So after my first baby, almost 5 years ago, I just did not feel like myself, which
Mm,
is a term I hear almost every day. Um, I just had word finding difficulty, couldn't think straight. I never felt depressed, and that's kind of the label that was given to me is postpartum depression. But I'd never ever felt depressed or sad.
mhm.
I was just like my brain is not functioning. Um, so I went to my OB, who's wonderful, and she offered me an antidepressant. I'm like, that's not what I need. Like, there's something going on. So I dug into the integrative medicine approach, looked at my gut health, looked at my hormones. I was still breastfeeding. I breastfed for about 17 months, and still at that 1 year mark, I was like, I should be feeling better. So this is
Mhm.
when I did that approach, and I found that my hormones were still at the postmenopausal level, which was just so eye-opening for me, and found that I had some gut issues. So I worked on my inflammation, worked on supporting my hormones, and I felt better within 3 days. And so this was just so eye-opening to me, because then I was able to realize that this is exactly what my patients have been telling me when they're in that perimenopause stage. So I was essentially menopausal during
Mhm.
this breastfeeding time, and knowing that so many women have these same complaints and aren't getting the help that they deserve, I made it my mission to try to learn as much as I could and help these women going through this, because it was horrible. Having to be on every day at work is essential when you're taking care of patients. So I had to help myself so I could help others. And it was just such an amazing journey. I'm so glad I went through it just so I could learn, and now help countless women. And so I I opened my own practice because I realized there's just not much access out there for women.
Mhm.
Um, so even like in my roles within a system, I am able to help women, but still, like we need more practitioners in this space.
Yeah.
So I thought, let me open my own practice, offer just a little bit more accessibility to some women. So that's where I'm at.
That's awesome. I really appreciate really anybody that follows their passion, and obviously we have some similar areas of passion in this
Mhm.
realm, and I so appreciate the leap of faith that it takes to start a practice and to do the scary thing, the hard thing. So kudos to you. That's awesome. You
Thank you.
talked a
Yes.
little bit about the perimenopause, menopause. let's just dive right into that. So, how do you define perimenopause? Is there a specific clinical definition? Is it a symptomatic definition? Are there biomarkers that are involved? Talk a little bit about that, if you would.
Yeah, perimenopause is so broad for everyone. I see perimenopause every day, and everyone is different. It can be just not feeling like myself. That's a common phrase that I hear, and a research article actually just came out about this, as that can be a definition of perimenopause. It can be changes in periods, changes in mood, um, fatigue, some hot flashes, night sweats, and sleep. That's a huge thing that I see. When patients say they wake up at 2, 3 a.m., that's just so common in those
Mm.
early perimenopause stages that can continue. So yeah, it looks different for everyone. You can have one system or one symptom, or you can have multiple. And the severity changes. It's very different for everyone. So yeah, it's often just based on those symptoms that are new for you, and likely some period changes as well.
So, if a woman comes into you and is describing maybe one or a cluster of some of the symptoms that you described, what are your next steps?
Yeah. So, excuse me. From I love taking an integrative approach to this because it's in medicine, a lot of times it's very siloed, but it is the whole person. So first and foremost, I make sure that those foundations are there, making sure diet is in check, because that is huge for symptom management. Um, Also making sure you're getting some movement, making sure you're doing the best you can with stress. I mean, so many of the women I see are similar age to you and I, that,
Mm.
you're in the thick of it with kids. Also, your parents are aging, there's just stress everywhere. You're at
Right.
the height of your career. So stress is very difficult to manage, but we do our best. Um, and yeah, so I hit on the big one. So just those general foundational things is number one. But then we talk about, like, what are our options. There's different schools of thought in the perimenopause menopause world, that yes, we need to do labs, or no, you cannot do labs because it will not help you at all. I'm not absolute in my
Mhm.
care.
Mhm.
So I discuss the pros and cons with my patients. A lot of people like data, and like that's how I was too. I wanted the data. And so we can definitely check some labs if the patient wants, but knowing that it's not necessary to treat. So you can go down multiple avenues for the workup and the next steps.
Sure. If you do labs, are there certain biomarkers or blood tests or nutrient level tests that you're looking to do that would help inform your clinical decision making with that person?
Yeah. So for me personally, if I'm going to go all out and get all the labs, I will look at all of the sex hormones. I do also like looking at an inflammatory marker called HSCRP, um, that it's very nonspecific, but can kind of give us an idea if you're just dealing with general inflammation in your body. I also do look at some nutrients like vitamin D, vitamin B12, and iron. And last but not least is blood sugar.
Hmm.
Looking at blood sugar levels or fasting insulin. Because a lot of these markers do just naturally go up as our hormones start to go down. I joke with my patients that once we get to menopause, everything either goes up or down.
Hmm.
And so this is where all the lifestyle factors really come in, um, where it can help ease that big shift that happens in menopause. And yeah, so the testing can be small or can be larger. And of course, if there are some gut issues, I like to look into that as well,
Hmm.
because that can just be a big driver of inflammation and some hormone dysregulation.
Sure.
So,
Well, let's dive into some of those foundations that you talked about. So you mentioned
mhm,
diet, movement, stress management. So, I mean, you've got everybody
yeah,
from the vegan folks, the folks that are carnivore, you've got everything in
yep,
between, and I think diet is akin to religion these days. I mean, people get so emotionally attached to it. So I understand that it's a charged topic, but how do you approach that with your patients? Do you have some sort of middle of the bell curve approaches
mhm,
that you can do with people, or
yeah,
you're just going to meet them where they are? I mean, if they're dead set on being a vegan, you're going to work with them,
mhm.
or how do you approach that? It's such a difficult issue for so many people.
Yeah, it really is. I always tell my patients, if you are really passionate about a certain diet, I'm going to support you and see where we can optimize. And through this optimization process, you may find that the diet that you have been following for years might not be the best for your body at this point. Just because of all of the changes that happen, our bodies just might need something a little bit different.
Mm-hmm.
But no matter what diet anyone follows, I focus on high fiber, high veggies, because that is huge just for your hormones, your hormone metabolism, your inflammation, um, and for weight management, which is a big thing in perimenopause as well.
Hmm.
So focusing on that fiber piece and focusing on adequate protein. So in our society, it's so hard to get those. It does take a lot of planning. So I do work with my patients on giving them some ideas of things that have worked for me. Being a busy mom of three, working full time, finding those hacks that are just really easy to prep or just like grab and go. And of course, just tailoring it to the patient of what feels good to them. Um, but making sure it's optimal. It's not just about like what they like, it's about just optimizing.
Sure.
Mhm.
What recommendations do you have specifically with regards to protein? Do you have a formula or equation, this many grams per kilogram or pound of body weight, or how do you go about
Yeah.
prescribing that?
Yeah. So I try to keep it simple for patients. And usually, just across the board, I say try to aim for at least 100 grams of protein a day. Of course, there's the equations of like 0.8 grams per kilogram or to one gram per kilogram. Um, and a lot of my patients are really at like 30 grams a day. They're really low levels. So I say, okay, let's try to just increase. Maybe let's start with 60 grams a day, see if we can get there and then increase. Um, so yeah, trying to keep it simple.
Sure. What are some of the things that you'll often hear from patients as they maybe hesitantly, but they do start to increase their protein intake? Are there
Mhm.
certain reports that you'll commonly hear from them?
Yes, I tell you, I've had multiple stories that have been really incredible with just some minor diet tweaks.
Mm,
Like just recently, like within the past month, a few that I can think about are increased energy, sleeping better, not waking up as much at night. Um, Hot flashes have decreased significantly. Like that one that I had recently was so incredible. She was
mm,
having multiple terrible hot flashes per day. And just with some diet tweaks, brought it down to maybe one minor one a day. So these diet changes just can be huge, even like improving your brain fog, that cognitive functioning that can just
mhm.
waver in perimenopause can really, really clear up um, with some of these minor tweaks. And it doesn't have to be significant. I always say Rome wasn't built overnight. So
Mhm.
just, do the best you can. And once you start seeing a little bit of progress, you just kind of grab on and keep rolling with it. So it's so fun seeing some really positive changes with just some minor diet tweaks.
Yeah, that's great. I appreciate the the approach that you take where you're meeting people where they are and just working for incremental changes, I think probably it's very approachable for a lot of people to have. So we talked about some of your recommendations for protein. You mentioned about 100 grams per day, certainly give or take based on a person's body weight and ability. How about fiber content? Do you have a certain number of grams per day that you're shooting for that?
Yes, I tell people what would be amazing, absolutely optimal is 50 grams a day. But if you can get minimum 25 to 35, but in the range of 30 to 50 is best. Because especially, with that hormone drop, we just need all the help that we can get with maintaining our weight, maintaining our gut function, because the gut function does change also with the drop in hormones. So, yeah, we need all the fiber we can get.
Yeah, that's great. So 50 grams a day, it looks like is a recommendation or sounds like it's a recommendation for that. That's excellent. Let's talk about movement. You didn't say exercise per se, but you said movement. Talk to me about some of the recommendations that you have for women specifically with regards to that portion of the foundations that you described.
Yeah, 'cause exercise can be kind of a scary word for a lot of
Mm,
people. So I like to approach it in just a more simplistic way of just saying movement, because you don't have to go to CrossFit. You don't have to do triathlons. It can be as simple as walking. Um, I mean, optimally, you would be getting a few days a week of strength training just because our muscle mass does decline as we age. Again, another one of those things that just goes down when our hormones go down. So, supporting that muscle mass is just going to be really important for longevity, and being able to get on the floor with your grandkids.
mhm.
Um, but if that's too daunting for my patient, then I say get out for a walk. I mean, some of my most healthy patients walk 3 miles a day, no matter what. So there is power in something quote unquote simple and enjoyable like walking.
Sure. Well, it reminds me of some of the anecdotes that come from the study of the blue zones, which, if people are
Mhm.
not familiar with that, they're the concentrated areas around the globe where people tend to live into their hundreds at the highest rate. And if you look at many of these individuals, they're not working out in gyms, but they're walking, they're tending to the garden, they're playing with grandkids, they're fishing, they're just generally active. So it seems like your recommendations really echo some of the observed, I guess, routines or lifestyles of some of those people who are living into long and healthy ages.
Right, right. Yep, it doesn't have to be crazy. Just move.
Yes, yes. Something is better than nothing. That's very good.
Mhm,
So that then brings us to foundation number three. You talked about stress management. So how do you
mhm,
broach that subject and do you have any
mhm.
strategies that are general recommendations for folks that you work with?
Yeah, so as I said, stress is just so hard in this stage of life. Um, so stress can really, really wreak havoc on our hormones and can actually lead to a faster decline in hormones. So we um, we want to decrease the stress just for all of that symptom management. I have women who tell me that they know when they're stressed is when all of their perimenopausal symptoms are worse. Someone today just told me that she was getting hot flashes with this increased stressor in her life. So um, it's about like disconnecting from life. I tell patients, even if you can handle just 1 minute a day of not looking at your phone, listening to a guided meditation, something where you can just be and erase your thoughts and just be in the moment. Because there is power in that, even just those short spells. If you can make it 1 minute multiple times a day, even better. Or even if just like a walk is your stress reduction, that's great. And also just trying to set yourself up for success during the day too. Like, what things can you plan ahead? How can you delegate? Um, It's just the little things in this stage of then they can just add up.
Sure. How do you balance the idea of stress mitigation or trying to decrease stress versus the idea of shifting one's mindset around stress instead of, perceiving the traffic jam as this enemy, so to speak? You sort of make
Mhm.
peace with it and you learn to not be affected by those external things. How do you balance that when you are talking with your patients?
Yeah, yeah, that's brilliant. Definitely, if a patient comes to see me and they are discussing like all these little things are just getting to me, and so those are the patients that I know we have to work on, just like yeah, that reframing of
Mm. Mhm.
okay, like what is in our control? Um, Not much, and so and if we react in a certain way, how does that change the situation? This thing is going to happen no matter what. All we can do is control how we are reacting. So I kind of go through a talk similar to that of, getting worked up about these little things isn't helpful for our health, isn't helpful for the situation. Is it going to matter in 10 days, in 10 years? If it doesn't matter in the future, then it's not worth getting worked up about.
Sure. So we talked about diet, we talked about movement, we talked about stress. Where does sleep fall into that? Do you
Oh,
feel like
yes.
that's a component that is a byproduct, as in you're going to get better sleep when you are eating your best, when you are exercising or
Mhm.
moving optimally, when you are managing your stress, and the byproduct is better quality sleep? Or do you feel like sleep is its own foundation, as it were, that needs some, I guess, its own attention?
Yes, the answer is both.
Hmm.
Um, oftentimes I have a conversation about let's set some rules about bedtime. Is so many people will be watching a movie on their phone, staying up really late, and really just setting those boundaries so you can set yourself up for success for sleep. Because it is a foundation for health. But then yes, there's that other category of once some of these other foundations are kind of set up, you will have better sleep. So it's twofold. We have to be intentional in our sleep, but then also it will be just kind of a trickle down effect of the other aspects of our life.
Sure. Yeah, that makes a lot of sense. As you said, put the phone down early on, get the screens. And by the way, that also was part of the stress management. So you get it sounds like a two for
Mhm.
one if you just put the phone down. It's an amazing
Exactly.
thing when we can disconnect from technology. That's great. Talk to me a little bit about hormone optimization strategies. Is that something that most of the patients you work with have some sort of optimization strategy, or is it 50%, 25%? How do you go about determining who is appropriate for that?
Mhm. Great question, and I'm glad you asked because hormones are my favorite. I love prescribing hormones. I would say nearly everyone that I see is on hormones. Um, Often because, they've gone through all of these different avenues already of trying to get help and going through large workups of why am I feeling this way? And then they finally land on, oh, this could be menopause. And then they find someone like me that is open to prescribing. There's so much good data on hormone replacement therapy or menopausal replacement therapy, um, that there's almost more benefit than risk of being on hormones. So, but first and foremost, like the hormone optimization comes from the foundations. And then in early perimenopause, we can discuss just starting with some herbs that have been shown to just support your own natural production of hormones. But then often those are really short-lived, the benefits that you get of those,
Mm-hmm.
and then going into the prescription hormone replacement therapy. And this can just be a game changer for so many women. All of the symptoms that I talked about before are often improved with HRT. Um, and I prescribe estrogen, progesterone, and testosterone. Um, I Every single hormone has its benefit. Some women do great with just one. Some women do best with all three. And I really love finding the best cocktail for my patients because it can just be a huge game changer in their life, their vitality, and just every aspect of their life.
Sure. As far as finding that right balance of that cocktail, is that based off of trial and error? Is that based off of specific lab values? How do you go about working to tweak that so it's best for that individual?
Yeah, yeah. So I like to go off of symptoms. The Menopause Society, or previously known as the North American Menopause Society, doesn't really recommend labs when working with HRT. But again, how I said before, I'm not an absolute person, where most of my patients love the data. So there are some research studies that say, like, for osteoporosis prevention, as an example, you do need to have an estrogen or an estradiol level of at least 60. Some say 100. So, so there could be some benefit in that. But yeah, but often I go off of symptoms and will gladly check levels if the patient wants, or we need to figure out where we're going awry.
Sure. So if there's a woman listening to this that is thinking, "Oh, that may sound like where I'm at right now. Maybe I'm having some of these symptoms." What would you suggest as a first step for her seeking care?
Mhm. Well, first and foremost is just start now with those foundations, because that can just help so much. And then finding a menopause provider,
Mhm.
it can be really hard. Um, of course, Instagram is a great place where people find providers, which, I mean, that's the world we're in today. Talking to your friends, talking to the women at the gym, um, that's how a lot of people find me, is just through word of mouth.
Mm, mhm.
Um, and I find a lot of women just aren't really talking about it, but I guarantee, like, the women around you are going through similar and just maybe not recognizing it. Um, so yeah, it's hard, but um, doing a Google search, or yeah, asking your friends and social
So
media.
so when in doubt, find Jenikka. I think
That's
that's the
right.
short answer for that. Okay. So let's talk about how has your notion of aging changed as you've both gotten older, but also accumulated a lot more knowledge as a practitioner?
hmm Yeah, that's a beautiful question. It's in your early 20s or so, you just think, you know it all, you're invincible. But as you age, and you just realize, like, you just become more centered, and um knowing yourself better, knowing the world better, and just becoming more gosh, even keel is kind of the word coming to mind, but more balanced. That's the word. Is just becoming more balanced in who you are and your space in this world. um and I found that, like, in treating my patients, is uh, they're so intuitive into what they're feeling.
Mhm.
And so many women have been written off with their symptoms and their stories. And uh, you know yeah, I've just really been impressed at the stories that I hear from women, is like, they know there's something, and they're usually right. So just, yeah, gaining that intuition in yourself is really, really interesting.
Yeah. Over the last year or so, I've been purposefully trying to think and make decisions more so with how it feels in my body, not just what it
Mhm.
my brain comes up with a pro and con list and going from there. But I'm sure you've had many experiences where, your mind maybe said yes or it said no, but your body had a different feel to it, whether to go out and meet that person or to invest in this thing. I think there is so much wisdom in our bodies, as you
Yeah.
said. So I think that's really good. Do
Yeah,
you
that's
personally? Yeah, go ahead.
yeah, just to piggyback on that, I had a life coach years ago who was so incredible. One thing she taught me with making a decision is, does it feel heavy or light?
Hmm.
And that has guided me so much over the years, and I'm just forever thankful for her for just that one thing she said to me.
That's well said. Heavier light. I like that. I'm
Mhm.
going to use that. I think that's
Yes,
excellent.
good.
So living in a house with so many young children, obviously our personal needs are get, back burnered, so to speak. But
Yes.
do you have any non-negotiables in your
Yeah.
world as far as personal health, whether that's you got to get this amount of sleep or you're gonna do this type of exercise or diet related things? Do you have any things that are musts for you?
Yeah, yeah, but that has been so hard. I have three kids, four and under, and it is so busy. And the one thing that I've found that's really tangible that makes me feel better is making sure I'm getting my multiple veggies per day. Like we had just had Memorial Day weekend and I did not get them, and I felt it. I wasn't as clear. I just felt inflamed overall and my gut health was off. So, um making sure that I get usually I really try to shoot for at least five vegetables a day, and eating the rainbow. And that is really, really huge for my health. I have always been really big into exercise, and that season has kind of taken the back seat, with these littles. And I heard someone wise say years ago that if you have a choice between exercising or sleep, choose sleep. Because if you're so stressed, so exhausted, and you try to get that exercise, it can just backfire. And I experienced that after my first. I wanted to get back
Mm-hmm.
to exercising so bad. And that's where I ran into more trouble, where I got injured and I was seeing you a lot, and just did not feel good. So I realized with my subsequent pregnancies that, I have to listen to that sleep piece first and foremost. Um, so the thing that is tangible for me right now just is that diet piece.
Sure. Yeah, I think that's excellent. So there's probably some people listening to this thinking, I would love to schedule a time to chat with Jenikka if possible, or to find her. So do you do phone consultations with people like discovery calls? And if so, how
Mhm.
how can people find you?
Yes, yes. I'm more than happy to do just a free, brief um, discovery call, basically, just to see if this is a right fit. I want to make sure that you are getting the right care, making sure that I'm the right person for you, and also that you think that I'm the best fit for you. Um, so the name of my business is Superior Integrative Medicine, named after Great Lake Superior, since I grew up near the Great Lake. Um, and yeah, my website is superintegrativemedicine.com. And you can find more information there, and my email, and how to connect with me.
Awesome. Well, let me just do a quick little recap here, and if I'm omitting anything vitally important, then please add that in. So we started by talking about foundations for health, and you indicated diet, a couple of the specifics that you talked about. 50 or grams of fiber a day seems to be a really important thing for most folks, and upwards of 100 grams of protein per day often can be a very healthy place. You indicated the the risk of losing muscle, sarcopenia, as sometimes it's referred to, as a big component of that. Movement, you were very particular about your words with that, and meeting people where they are as far as that's concerned, and just encouraging rather than laying down any draconian exercise routines, hit workouts, or anything of that sort. And then you talked about stress management and the importance of putting the phone down, trying to be present, having a space to be able to do a breath practice or a meditation, that sort of thing. And those often will help to lead into other components or aspects like sleep, improving that, which also is benefited by putting the phone down as well. You talked about really the importance of hormone optimization and how just about everybody that you work with, you find that there's some benefit to optimizing hormone levels. And you gave a couple of examples for that. And then just personally, just the value of veggies, as you said, eating the rainbow, multiple colors, and getting that fiber in. And I contend that there are so many people who have just consistently felt bad that they don't know what it feels like to feel good. And so when you yourself have done practices to help yourself feel good, you so tune into that feeling of feeling bad. And I guess my hope is that more people can experience what it's like to feel good again. And I think a lot of the work that you're doing is a testament to that, that women are feeling good probably for the first time in a long time.
Right, right. I agree. Yeah, it's hard to think about what could be when you're in the state that you are in. And I am, like I said, I'm glad that I have a little bit of experience of just knowing what is really easy. What is something that I can recommend that really can be just a tangible thing for a patient to implement.
That's awesome. Any last words of wisdom? Any last bits you'd like to leave with the audience, Jenikka?
Yes, just start now because setting yourself up for success, if you're in your 30s, start with those health foundations right now. It is just going to lead to such an easier transition as you age. Even if it's something little, don't discount just those little baby steps.
Awesome. Well, speaking of baby steps, who knows? There might be some littles running around right now. It's
Yes, you're
probably
right.
getting hopefully past bedtimes if they're not in already. Well, I really thank you for taking this time out of your very busy day to share some of your wisdom that you have with our audience. So I appreciate the time. Again, that's Superior Integrative Medicine for people who are interested in learning more about Jenikka and her practice. Thanks again for taking the time, Jenikka, and we'll talk soon.
My pleasure. Thanks, Galen.
All right. Good night. Well, thank you for listening to the Better with Age podcast, episode number 3 with Jenikka Tomashek. I hope you enjoyed our conversation all about perimenopause. Hopefully picked up a few ideas or thoughts about what you might be able to do to optimize your health. If you're interested in learning more about Jenikka, you can check out her website at superior-integrativemedicine.com. If you're interested in learning more about the Better with Age program, a program that was designed by my wife Leah, who's a licensed nutritionist, and myself, physical therapist, is at www.betterwithage.online. The program is designed to help women build bone density, muscle strength, balance, gut health, brain health, all the things that are vital to living a happy life full of vitality and not just counting out your days and not being able to do the things that you want to do. If you go to the website right now, we have a free breathing course that is up there. If you are interested in learning optimal mechanics for your breathing and how to actually quantify how well you are breathing using what's called the breathing IQ. So again, that's www.betterwithage.online. Until next time, this is Galen signing off, wishing you health and happiness. Good night.